Every single winter, 65 million working adults in the United States catch at least one respiratory infection, not a mild sniffle. A full week of misery, missed work, disrupted sleep, sometimes antibiotics that wreck your gut for months. And here is what nobody tells you. In more than 70% of those cases, the infection did not start in your lungs. It started in your nose, sat there quietly for 3 to 5 days, and then migrated downward while you had no idea it was happening. I am going to tell you exactly how to stop that process before it starts. Not with expensive supplements. Not with pharmaceutical interventions that suppress symptoms while your immune system stays weak. With a simple nasal and respiratory flush protocol that costs less than $2 per month and takes 5 minutes twice a day. Subscribe to Dr. Waterling right now and hit that like button. We are working toward building this channel on one principle. The system makes money when you stay sick, not when you get better. What I'm about to share with you, no doctor is going to walk you through in a 12-minute office visit because there is no billing code for prevention. Let me be very direct with you. Your respiratory tract, from your nostrils down to the deepest branches of your lungs, is lined with a continuous membrane covered in mucus. That mucus is not dirt. It is your first line of immune defense. It traps viruses, bacteria, pollution particles, allergens, everything that does not belong in your body. But here is the problem. That mucus only works if it moves. If it sits stagnant, it becomes a breeding ground. Viruses replicate. Bacteria colonize. Inflammation begins. And by the time you feel the first tickle in your throat, the infection is already established deep enough that your body has to mount a full inflammatory response to clear it. That response is what you experience as being sick. The fever, the congestion, the fatigue, the cough. All of it is your immune system trying to expel an invader that got past your defenses days earlier. Now, why does mucus become stagnant? 3 reasons. First, dry air. Heated indoor air in winter drops humidity to 10 or 15%, sometimes lower. Mucus is 95% water. When the air is dry, mucus thickens, slows down, stops moving effectively. Second, inflammation from previous infections or allergies. Inflamed tissue swells. Swollen tissue narrows airways. Narrow airways trap mucus. Third, and this is the one almost nobody addresses, you are not mechanically clearing your nasal passages. You blow your nose when it is running, but you are not proactively flushing the system before problems develop. Let me tell you about a patient I saw 8 years ago. Margaret, 52 years old, working in an office with recirculated air. She came to me in January after her 3rd respiratory infection in 4 months. Chest x-ray was clear. Lung function was normal. But she was exhausted, frustrated, and convinced something was deeply wrong with her immune system. She had tried vitamin C, zinc, echinacea, probiotics. Nothing changed the pattern. Every 6 to 8 weeks, another infection. I asked her one question. When do you clean your nasal passages? She looked at me like I had asked her when she washes her elbows. The concept had never occurred to her. I taught her the protocol I am about to teach you. Within 2 months, the infection cycle stopped. She went the entire following winter, January through March, without a single sick day. That was not luck. That was physiology. When you remove the breeding ground, pathogens cannot establish infection. Here is your complete protocol. You need 3 things: filtered or boiled water, non-iodized salt, and baking soda. That is it. The total cost is under $2 for a month's supply. Do not use tap water directly. Tap water can contain microorganisms that are safe to drink because stomach acid kills them, but dangerous if they reach your sinuses where there is no acid barrier. Boil tap water for 3 minutes and let it cool, or use distilled water or use water that has passed through a point-of-use filter rated for 0. 2 microns or smaller. Here is the formula. Take 240 milliliters of water. That is 1 cup. Add half a teaspoon of non-iodized salt. Regular table salt has iodine added. You do not want that in your nasal passages. Use sea salt, kosher salt, or specifically labeled non-iodized salt. Add 1/4 teaspoon of baking soda. That is sodium bicarbonate. The salt creates the correct osmotic balance so the solution does not burn or sting your nasal tissue. The baking soda buffers the pH to match your body's natural mucus pH, which is slightly alkaline, around 7. 4. If you skip the baking soda, the solution will feel uncomfortable and you will stop doing this. If you skip the salt or use the wrong concentration, you will create either a hypertonic solution that draws water out of your tissues and stings, or a hypotonic solution that swells your tissues and feels like you are drowning. Get the measurements right. Mix the solution thoroughly until the salt and baking soda dissolve completely. The water should be body temperature, approximately 37 degrees Celsius or 98 degrees Fahrenheit. Not cold, not hot. Test it on the inside of your wrist like you would test a baby's bottle. It should feel neutral, neither warm nor cool. Now, the technique. You have two options. The first method uses a neti pot, which is a small vessel with a spout. The second method uses a squeezable nasal rinse bottle. I recommend the bottle because it gives you more control over pressure and flow. You can buy one at any pharmacy for $3 to $5. It will last years. Fill the bottle with your prepared solution. Lean forward over a sink at about a 45-degree angle. Tilt your head slightly to one side. Place the tip of the bottle at the opening of your upper nostril. Breathe through your mouth. This is critical. If you hold your breath or try to breathe through your nose, you'll accept if you was that mean does is that mean does and you will choke. And you want that need that. Breathe normally through your open mouth. Gently squeeze the bottle. The solution will flow into your upper nostril, travel through your nasal cavity, and drain out the lower nostril. You will feel the liquid moving. It is not painful. It is strange the first time, but not painful. Let the solution drain completely. Do not blow your nose yet. Repeat on the other side. Tilt your head the opposite direction, bottle tip in the other nostril. Squeeze gently, let it drain. After you have flushed both sides, gently blow your nose to clear any remaining solution. Do not blow hard. Gentle exhalation is enough. Hard blowing can push solution into your eustachian tubes and cause ear discomfort. Some solution may drain down the back of your throat. That is normal. Just spit it out. Do not swallow it, but if you do accidentally, it is just salty water. It will not hurt you. Do this twice a day, morning and evening. Morning flush clears out everything that accumulated overnight while you were breathing stagnant bedroom air. Evening flush clears out everything you inhaled during the day. Pollution, pollen, viral particles from public spaces, dust, smoke. This is not a treatment for when you feel sick. This is prevention. You do this when you feel perfectly fine because the goal is to never get to the point where you feel sick. Now the lung component. Your lungs have their own cleaning system called the mucociliary escalator. The airways are lined with tiny hair-like structures called cilia. These cilia beat in coordinated waves, moving mucus upward from the deep lung toward the throat where you either cough it out or swallow it. This system works beautifully when you are healthy, but it slows down dramatically when you are dehydrated, when you breathe polluted air, when you have even minor inflammation. You need to support it mechanically. Here is the lung flush protocol. Twice a day, after your nasal rinse, you are going to do controlled coughing with hydration. Drink 250 milliliters of warm water, not cold. Warm water about the temperature of tea. This hydrates the mucous membranes and thins any mucus present in your airways. Wait 2 minutes. What stance is it? Then perform 3 cycles of deep breathing followed by controlled coughing. Here is the technique. Stand upright. Inhale slowly and deeply through your nose, filling your lungs completely. You should feel your ribcage expand in all directions, front, sides, and back. Hold that breath for 3 seconds. Not longer. 3 seconds. Then exhale slowly through your mouth until your lungs feel empty. Repeat that twice more. 3 total deep breaths. On the third exhalation, when your lungs are about halfway empty, perform 2 short, sharp coughs from your diaphragm. Not throat coughs. Deep coughs that you feel in your abdomen. These coughs create sudden pressure changes that dislodge mucus from airway walls and propel it upward. You may not cough anything up, especially if you are healthy. That is fine. The mechanical action is still clearing microscopic particles and stimulating ciliary movement. If you do cough up mucus, spit it out. Look at it. Clear or white mucus is normal airway cleaning. Yellow or green mucus indicates infection or significant inflammation. If you are coughing up colored mucus for more than 3 days, see a doctor. If you cough up blood, see a doctor immediately. But in most cases, consistent use of this protocol prevents you from ever reaching that point. Do this entire routine, nasal rinse plus lung breathing and coughing, twice a day. It takes 5 minutes total, morning and evening. The best times are right after you wake up and right before bed. Morning clears the overnight accumulation. Evening clears the daily exposure and ensures you sleep with clean airways, which improves sleep quality and gives your immune system optimal conditions for overnight repair and regeneration. Now let me tell you what happens when you do this consistently for 2 weeks. First week, you may not notice dramatic changes. You might notice that you wake up less congested. You might notice that the air feels clearer when you breathe. Small things. Second week, you will notice that you are not getting the minor scratchy throat that used to signal the start of a cold. You will notice that when people around you are getting sick, you are not. By the third and fourth week, this becomes your new normal. Your nasal passages feel clear. Your breathing feels easy. You stop thinking about your respiratory system because it is working the way it is supposed to. Here's what the research shows. A study published in the American Journal of Rhinology and Allergy followed 400 adults who performed daily nasal irrigation during cold and flu season compared to 400 adults who did not. The irrigation group had 64% fewer upper respiratory infections. 64%. That is not a small effect. That is a massive reduction in illness frequency. The mechanism is simple. You are physically removing pathogens before they can establish infection. You are maintaining optimal mucus flow. You are supporting your body's natural defenses instead of waiting for them to fail and then trying to rescue the situation with medications. Now, I need to address safety. This protocol is safe for the overwhelming majority of adults, but there are specific situations where you need medical guidance before starting. If you have had sinus surgery, skull-base surgery, or significant facial trauma, talk to your ENT doctor before doing nasal rinses. If you have a severely deviated septum or nasal polyps, you may need evaluation first. If you have a condition that affects your immune system or your ability to clear infections, discuss this with your physician. If you experience significant pain, bleeding, or ear pressure when you try this, stop and get evaluated. Those symptoms are not normal and may indicate structural issues that need professional attention. One more thing, do not add anything else to the rinse solution unless you are working with a physician who has prescribed it. No essential oils. No hydrogen peroxide. No colloidal silver. No vinegar. Those substances can damage the delicate ciliated cells that line your nasal passages. The simple saline and baking soda solution is all you need. It matches your body's natural chemistry. It is gentle. It is effective. Do not complicate it. Let me also be very clear about what this protocol does not replace. If you develop a fever over 38, 3 degrees Celsius, or 101 degrees Fahrenheit, if you have difficulty breathing or chest pain, if you develop a severe headache with neck stiffness, if you become confused or disoriented, those are signs of potentially serious infection or other medical emergency. Call your doctor or go to the emergency room. This protocol supports your normal immune function. It does not treat pneumonia, COVID-19, influenza that has already progressed to systemic infection, or any other serious respiratory illness. Know the difference between prevention and treatment. Use this for prevention. Seek professional medical care for serious illness. Now let me tell you about the second patient who changed how I think about this. Robert, 68 years old, retired, living in a cold climate. He came to me in March after spending the entire winter in a cycle of antibiotics. Sinus infection in November, bronchitis in December, another sinus infection in January, pneumonia in February. He was exhausted, his gut was wrecked from repeated antibiotic courses, and he was terrified that something was fundamentally broken in his immune system. I taught him this exact protocol. The following winter, he did the nasal and lung flush twice daily from October through March. He did not miss a single day. He did not get sick once, not one infection. His words to me in April were, "Bans nasa du bursaitik." I forgot what it felt like to go through winter as a healthy person. That is what this protocol gives you. It gives you back normal function, not superhuman immunity. Just normal, healthy respiratory defense working the way it is designed to work when you support it properly. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Here is your implementation plan. Tonight before bed, boil water and let it cool. Mix your first batch of rinse solution. Do your first nasal flush and lung breathing cycle. Tomorrow morning, do it again. Do it every morning and every evening. Do not skip days. Consistency is what creates the protective effect. Missing one day here and there will not ruin everything, but sporadic use will not give you the full benefit. This works because you are maintaining continuous clearance. You are never letting pathogens get a foothold. If you travel, bring your supplies. A small bottle of non-iodized salt and baking soda takes up almost no space. You can mix the solution fresh in any hotel sink using boiled water from the coffee maker or water you have brought with you. Do not skip your routine just because you are away from home. Travel exposes you to more pathogens than your normal environment. Recirculated airplane air, hotel ventilation systems, crowded public spaces. You need your protective routine even more when you travel. If you have children, teach them this protocol. Children get 6 to 8 respiratory infections per year on average, and sets us into the sinus. That is considered normal, but normal does not mean optimal. Kids as young as 4 or 5 can learn to do nasal rinses with supervision and appropriate child-sized equipment. You are not just preventing this winter's colds. You are teaching them a lifelong health practice that will serve them for decades. One final note, the system you rely on for your health is not built to keep you healthy. It is built to treat you when you get sick. There is no billing code for teaching you how to prevent infections. Your next doctor's appointment will not include instruction on nasal hygiene because there is no revenue in it. A 12-minute office visit generates a reimbursement. Prevention education does not. That is why you are learning this here. That is why this channel exists. To give you the information that serves your health, not someone else's revenue model. If this video helped you, send it to someone you care about. A parent, a friend, someone who gets sick every winter and thinks that is just how it has to be. You may have just given them a real chance to break that cycle. Subscribe to Dr. Waterlink. We are building something important here. Every subscriber moves us closer to reaching people who need this information. Hit that like button, comment with your age, and I will see you in the next video where we are going to talk about why your joints hurt more in winter and the 3-minute morning routine that stops it.